Imagine this, you're cruising at 35,000 feet, enjoying the in-flight entertainment, but unbeknownst to you, a silent health threat is brewing. Today we're diving into the hidden danger of long flights, a condition known as chronic venous insufficiency or CVI. CVI is a condition where your veins, specifically those in your legs, struggle to send blood back to your heart. It's a common issue, particularly among those who spend long periods sitting down, such as during those lengthy transatlantic flights. So what sparks this problem? Well, when you're sitting for extended periods, the blood flow in your legs slows down. This sluggish circulation makes it harder for your veins to push blood back up towards your heart. Over time, this can lead to CVI, a condition that affects up to 40% of adults. Now you might be wondering, what are the symptoms of CVI? Common signs include swelling in the lower legs and ankles, especially after extended periods of standing. You might also notice varicose veins, those bulging bluish veins that appear just under the skin. In more severe cases, changes in skin color, leg ulcers, and even aching or feelings of heaviness in the legs can occur. Of course, not everyone on a long flight will develop CVI, but certain risk factors can increase your likelihood. These include age, a family history of varicose veins, obesity, pregnancy, and a sedentary lifestyle. Unfortunately, CVI is not just a flight problem. It's a health issue that can lead to serious complications. So the next time you're on a long-haul flight, remember it's more than just jet lag. Stay tuned for more on CVI. Now you might be wondering, what exactly is chronic venous insufficiency? Well, let's break it down. Imagine your veins as a series of one-way roads that carry blood from your body back to your heart. They have these tiny little gates called valves that prevent the blood from flowing backward. Now, chronic venous insufficiency, or CVI, occurs when these valves don't work as they should, allowing blood to pool in the veins, particularly those in your legs. So let's translate that into everyday language. You know how water gathers in a sink when the drain is partially blocked? That's kind of what's happening in your veins with CVI. The blood can't flow smoothly back to the heart, so it starts to gather in one place, causing the vein to swell and stretch. Now, why is this a problem? Well, it's not just about the discomfort or the unsightly varicose veins that can occur. Over time, this pooling of the blood can cause a host of complications, some of which can be quite serious. For instance, CVI can lead to skin changes and ulcers, which are open sores that can take a long time to heal. It can also increase the risk of deep vein thrombosis, a blood clot that forms in the deeper veins of your body. This is a serious condition because if a piece of the blood clot breaks off, it could travel to your lungs and cause a pulmonary embolism, a potentially life-threatening situation. Additionally, untreated CVI can result in a condition called lipodermatosclerosis, where the skin around your ankles becomes hardened and discolored, and it can even cause a type of eczema that results in itchy, red, and swollen skin. CVI isn't just a fancy medical term. It's a real condition that could have serious implications for your health. So it's important to understand what it is, how it affects your body, and what you can do to prevent or manage it. So how does sitting on a long flight tie into all this, you may ask? Well, let's dive right in. Recent research has been drawing connections between prolonged sitting and chronic venous insufficiency, or CVI. Now, this might seem a bit surprising at first, but when we break it down, it starts to make a lot of sense. You see, when we're seated for extended periods, especially in cramped conditions like on an airplane, our leg muscles aren't contracting as much as they would when we're moving around. Without these contractions, the blood in our veins has a tougher time flowing back up towards the heart. So what happens when the blood can't efficiently make its way back up? It starts to pool in the veins of our lower legs. Over time, this pooling can lead to increased pressure inside the veins. This pressure can cause the vein walls to stretch and the valves to weaken, both of which are key features of CVI. To add to this, the low cabin pressure and dry air in an airplane can cause dehydration, thickening the blood and making it even harder for it to flow. Essentially, the conditions on a long flight create a perfect storm for blood pooling and subsequent CVI risk. Now, this isn't to say that every long flight will result in CVI. It's more of a cumulative effect. The more often and longer you sit, whether it's on a plane, at your desk, or on your couch, the higher your risk of developing CVI becomes. And it's not just CVI. Prolonged sitting has been linked to a whole host of health issues, from heart disease to diabetes. But for now, our focus is on how it relates to vein health. So there you have it. Sitting for extended periods isn't just about discomfort or bad posture. It can also lead to blood pooling in your legs, increasing your risk of CVI. It's clear that sitting for extended periods isn't just bad for your posture, it could also be harming your vein health. Now that we've laid out the problem, let's talk solutions. Chronic venous insufficiency, or CVI, can be a real pain, quite literally. But don't worry, protecting yourself from it isn't as daunting as it might sound. There are some simple, practical steps you can take to prevent CVI, especially during long flights. First and foremost, you need to keep moving. When you're on a long flight, it's easy to get comfortable in your seat and stay put. But that can lead to poor blood circulation, and we know that's a significant contributor to CVI. So, make it a point to get up and walk around the cabin every hour or so. If you're window shy or don't want to disturb your fellow passengers, don't worry. You can do simple exercises right in your seat. Flex your ankles, rotate your feet, or do some calf raises. These movements can help stimulate blood flow and prevent blood from pooling in your veins. Next, let's talk hydration. You might be tempted to limit your fluid intake to avoid frequent restroom visits, but staying well hydrated can actually help prevent CVI. When your body is well hydrated, your blood is less likely to clot. So drink plenty of water before and during your flight. And while we're on the topic of fluids, let's not forget that alcohol and caffeine can dehydrate you. So, as much as you might enjoy that in-flight coffee or cocktail, it's best to limit your intake. And finally, consider wearing compression stockings. These are specially designed to apply gentle pressure to your legs and ankles, helping to promote blood flow and prevent CVI. They might not be the most fashionable choice, but they can be a real vein saver on long flights. With these tips in mind, you can take steps to protect your vein health, even on the longest of flights. But what if you're not a frequent flyer? Are there other ways to prevent CVI? Absolutely. Chronic venous insufficiency, or CVI, isn't exclusive to those who travel long distances. It can affect anyone, and prevention is key. Incorporating simple lifestyle changes into your routine can make a world of difference. First and foremost, regular exercise is a must. Cardiovascular activities such as walking, running, cycling, or swimming can strengthen your leg muscles, promoting good blood flow. The important thing is to keep moving. Make it a point to take breaks from sitting or standing for extended periods. If your day-to-day job requires you to be on your feet or at a desk all day, take short breaks to walk around. This helps keep the blood pumping and prevents it from pooling in your legs. A healthy diet is another crucial component. Consuming a balanced diet rich in fiber and low in salt can prevent high blood pressure, a risk factor for CVI. Foods that are high in antioxidants, such as fruits and vegetables, can also strengthen your veins and promote good circulation. Remember to hydrate as well. Drinking plenty of water can improve blood flow and prevent dehydration, which can make CVI symptoms worse. Avoiding prolonged standing or sitting is also important. If you're in a situation where you can't avoid standing or sitting for long periods, try to change positions frequently. If possible, elevate your legs above heart level for 15 minutes a few times a day. This can help reduce swelling and improve blood flow. Lastly, maintain a healthy weight. Extra weight puts additional pressure on your veins and can contribute to the development of CVI. If you're overweight, losing even a small amount can significantly reduce your risk. Remember, your health is in your hands, and with these tips, you can keep CVI at bay. As we come to the end of our journey today, let's take a moment to reflect on what we've learned. We've taken a deep dive into the hidden dangers of long flights and prolonged sitting, specifically focusing on chronic venous insufficiency, or CVI for short. This term may have sounded foreign to some of you initially, but now we hope it's become a familiar concept, a testament to your journey towards better health and wellness. We've uncovered the definition of CVI, a condition where the veins in the lower limbs fail to circulate blood effectively, leading to a host of uncomfortable and potentially dangerous symptoms. This condition is more than just an inconvenience. It can significantly affect one's quality of life if left untreated. In our exploration, we discovered the surprising link between CVI and prolonged sitting, particularly during long flights. It's a connection that's often overlooked. but one that's crucial to understand for our overall health. By remaining seated for extended periods, we're inadvertently putting increased pressure on our veins, leading to a higher risk of developing CVI. But it's not all doom and gloom. We've also presented actionable steps to protect ourselves from CVI. Remember, it's all about movement. Regular stretches, walks, and exercises can significantly improve venous circulation. Hydration and a balanced diet also play a vital role in maintaining good vein health. In addition, we've explored further health tips, providing a broader perspective on how to lead a healthier lifestyle. It's all about making small, consistent changes that have a lasting impact. So, whether you're a frequent flyer or someone who spends a lot of time sitting, remember to prioritize your vein health. It's these seemingly minor details that can significantly influence our overall wellness. Thank you for joining us on this journey, and remember, your health is your wealth. Until next time, stay healthy. Before we wrap up, we have a small request. If you found the content of this video helpful, we urge you to take a moment to subscribe to our channel. By doing so, you'll be joining a community dedicated to spreading awareness about important health issues like CVI. Your subscription not only allows us to continue producing these informative videos, but it also sends a clear message that you're committed to your health and you're not alone in this journey. If you've enjoyed this video, please give us a thumbs up. Your likes encourage us to keep pushing the boundaries of what we can achieve in terms of delivering high-quality, accessible health information to everyone. Our channel, Medicine Health 360, is more than just a YouTube channel. It's a platform where we bring the latest, most crucial, and systemic medical and health knowledge to you, with a simple and understandable approach. Our mission is to empower you to take charge of your health, one video at a time. So join us in this mission. Subscribe, like, and share our videos. Let's work together to create a healthier, happier world. Thank you for your continuous support. Until next time, stay healthy.